Good afternoon. I'm Dr. Dan Schatzberg. I'm the president of the Pennsylvania Chiropractic Association. We represent over 3,500 chiropractors in the Commonwealth. We're dedicated to the advancement of chiropractic as a viable and cost-effective healthcare choice in Pennsylvania and throughout the United States of America. We're here in Harrisburg today as advocates for our patients in seeking lower costs and guaranteed coverage of physical medicine, especially chiropractic healthcare services, and freedom of choice in those healthcare decisions. We are urging our state lawmakers to support such initiatives as the Fairness in Co-Payment Act and the Retroactive Review Bill, which have already been introduced and are now winding their way through the legislative process. These bills will help reduce out-of-pocket expenses for our patients and guarantee insurance coverage and timely reimbursements for the treatments they receive. Now, I'd like to call on Senator David Argall from Berks and Schuylkill counties. He's the sponsor of Senate Bill 998, the retroactive review legislation, which is vital to all providers all over the Commonwealth of Pennsylvania. Senator.
Now, this is not a new issue, but it is a growing issue of fundamental importance. We understand that there's a growing partnership of many different groups that may not be in complete accordance on every single issue in this building, but on this issue, as I said, of fundamental fairness, they are absolutely in agreement. The Medical Society, the Chiropractic Association, the Occupational Therapy Association, the Orthopedic Society, the Physical Therapists, the Dental Association, the Hospital Association, and more groups every day have signed on to support this bill, which I've introduced on their behalf, along with Senator Alloway, Senator Rafferty, Senator Gordner, Senator Brubaker, Senator Schwenk, Senator Kasunik, Senator Tartaglione, Senator Mensch, and Senator Farnese. In this building, of course, you need 26 votes in the Senate, 102 votes in the House, and a governor willing to sign it. I believe that with this growing understanding of this issue, as well as with these partnerships of different professional groups, Republicans and Democrats coming together to make sure that when a service is provided, an important service, an important health service to not just my constituents, but constituents all across the state of Pennsylvania, those professionals deserve to be reimbursed in a timely basis. That's why I've agreed to sponsor this bill, and I look forward to joining all of you upstairs in the governor's office for the bill signing ceremony later this session.
Another problem we have is that of multiple co-pays and physical medicine management program. To speak on those subjects, Dr. Eric Osterberg, our legislative chairman, and also the vice president of the Pennsylvania Chiropractic Association.
Thank you very much, Dr. Schatzberg. My name is Eric Osterberg, and I've been a practicing chiropractor in Pennsylvania for 17 years, and I also work with the Pennsylvania Chiropractic Association on their board. In my role with the PCA, I've gotten to meet lots of doctors, and the one thing they all have in common is they joined into healthcare because they want to help patients. And with our current insurance environment, particularly health insurance, it's becoming harder and harder to help patients. It is vitally important that our legislators take a look at the physical medicine management programs that local insurance companies are putting into place. These programs are cost containment programs that don't necessarily rely on nationally published guidelines and widely accepted practice guidelines, but they rely on third-party companies from outside of Pennsylvania to reduce the services that patients inside of Pennsylvania can receive. Just imagine if you develop a serious spinal condition and you see your doctor, and you and your doctor agree that you should be seen twice a week for 2 months to treat this condition. If your insurance company says you can only have 10 visits, not 16, your outcomes aren't going to be very good. And to add insult to injury, some of the insurance companies are charging co-pays that are higher than the amount of the total service provided in the doctor's offices. Other insurance companies are charging multiple co-pays when more than one service is provided on one office visit. All of these cost containment strategies are shifting the financial burden directly to the patients and away from the insurance companies. It's bad healthcare policy, it's bad medicine, and it's a violation of the patient's right to choose the type of healthcare that they desire. It's a violation of their right to use the healthcare that they've faithfully paid their premiums for month after month. Senator McElhenney has introduced legislation, Senate Bill 594, that will limit the amount of a copay so it can never exceed the price of the service. He's also included in that bill limiting copays to no more than one copay per visit per patient. We strongly support the senator's legislation, and we'd like to see it moved out of the Senate Banking and Insurance Committee this year. And to sum it up, we believe that consumers need legislative protection to prevent these cost control efforts from being imposed directly on them. Thank you very much.
These are important pieces of legislation that we direly need. I'd also like just to add to the conversation a theme which is occurring more and more often. Here in America, we really don't have a health care system. We have a sick care system. Taking care of the sick is always more expensive than taking care of the healthy. We will always need a system to take care of the sick, but it would save a lot of dollars if we had a proactive wellness system preventing sickness. We need to look at that type of legislation going forward. Chiropractors are your primary health care providers for spinal health and wellness. I want to thank all of our legislators and all of our legislative champions who met with us today and who have joined us at this press conference. I'd also like to thank my colleagues for taking the message of chiropractic and the needs of our patients to our legislators today. We believe that our legislators are getting the message that chiropractic practice and physical medicine can be a vital and cost-effective part of the healthcare solution for many patients. We believe that the artificial barriers to physical medicine must end, and that consumers should receive the affordable quality care that they deserve. Thank you all very much.